Hi guys, this is Dr. Priyanka Mehta, health and wellness expert, obstetrician, gynecologist, and I welcome you to another episode on these videos for health and wellness for all. In today's video, let's talk about anemia. Anemia is a common condition, and anemia means that you're not able to work as per your full capacity because your hemoglobin is less. Hemoglobin is nothing but, so in our body we have blood which is running in all our arteries and veins in our blood vessels, and this blood has the oxygen carrying capacity, or this blood inside our body basically carries oxygen all across the body. And if there is lack of oxygen, we feel tired, we feel very lethargic, we feel some sense of difficulty in breathing also. So anemia is a condition of the blood in which the hemoglobin levels of our body become less. So anything less than 12 gram% as we say is called as anemia. And anemia is a condition where sometimes we don't even know till our body's hemoglobin becomes even less than 10 or 9, and that is when we start having the first symptoms, because our body is able to compensate for the initial stages of this anemia, or the blood becoming less, or the hemoglobin becoming less. So that is the reason why we advise you to do something called as the complete blood count at least once every 6 months or at least 1 year once, so that you are able to understand that if you are becoming anemic, if your hemoglobin is becoming less than 12, if your body is reducing the hemoglobin levels, so what is the reason why this is happening and how do we correct it? Now there are many causes for anemia, and especially in women, the most common cause is nutritional anemia, whereby because they are losing blood every month during their periods. If the period is a heavy period or it is for more than say 6 days or 7 days, again they may become anemic and their hemoglobin may become less than 12. And because this is happening over a period of time and they are not taking adequate nutrition, so they will have this slowly happening chronic anemia, we call it, and sometimes they won't even know till the hemoglobin drops down to even as less as 8 or 9, because our body is able to compensate and take care. So the common causes of anemia, as I told you, could be nutritional, where there could be iron deficiency, or folic acid is another vitamin deficiency, or vitamin B12 deficiency. Sometimes our body is not able to absorb the nutrition that we take. That could be because of some kind of a problem with your intestine, which is a malabsorptive problem. Say somebody has a celiac disease or some vitamin deficiency, so this iron is not absorbed. Many times also, if there is some kind of a problem with the intestine, or there is deficiency in certain factors, so people are not able to absorb the iron that they take in the diet. Now your complete blood count will indicate that your hemoglobin is less, and then we will be doing certain additional tests to identify what is the cause of anemia, because anemia can be, as I told you, if it is nutritional deficiency, we do another test called ferritin, which will tell us if the iron level is less. Then there is something called peripheral smear, which will help us to identify the cause of anemia, because sometimes even this blood carrying pigment called hemoglobin can have an abnormal shape or structure, and then it is not able to last for a long time. So normally in our human body, the blood has these red blood cells which contain hemoglobin, and this is what carries the oxygen and helps us to breathe without difficulty. But if the hemoglobin itself, which is carrying the blood, is not of a normal shape, then there also can be anemia, and these are certain conditions like sickle cell anemia or thalassemia, which we can diagnose by doing a hemoglobin electrophoresis. Now the anemia is identified, then the type of anemia is identified by your doctor, and you have to follow the advice of your healthcare provider depending on the kind of hemoglobin deficiency you're having and the reason for it. But the most common cause, as I told you, which is nutrition anemia, so you are either going to be given iron supplements, or initially we prescribe a iron-rich diet. And iron-rich diet is usually a diet in which we have a lot of green leafy vegetables such as spinach, and you have different kind of greens. So nutritional deficiency anemia can be corrected by taking more of iron-rich food such as almonds, walnuts, green leafy vegetables, egg, chicken, and other non-vegetarian products too. Remember that the vegetarian sources of iron such as your green vegetables and spinach, when you are taking those, try to avoid taking milk at the same time, because then the absorption is reduced. Vitamin C tablets or vitamin C rich amla, or as you say, gooseberry, oranges, or any other kind of lemon juice. So vitamin C helps in the absorption of iron. So when you take an iron tablet, then try to take it along with some vitamin C preparation, either a tablet or a natural source of vitamin C. Also, if you are having problems with your periods, say your bleeding is heavy, lasting for longer number of days, or you're bleeding a lot during your period days and you have to change more than 4 to 6 pads with lot of clots, do get that investigated, because if you are continuously losing a lot of blood during your periods, then the anemia will worsen, and then you're not actually treating the reason for the anemia. Also, even sometimes for both men and women, there could be a minimal amount of blood which is getting lost sometimes, say in the stools. So we often do a stool test because we call it as occult blood. Sometimes very microscopic amount of blood is lost over a period of time, and that could actually be an early sign of a cancer of the intestine or the stomach or the rectum, depending on from where the bleeding is happening. So it is so important that you do your complete blood count as part of your health check every year, so that if your hemoglobin levels are less than 12, we are doing the further tests, we are able to detect what is the cause of anemia, and we are able to treat it depending on the cause, and you don't miss out on something serious. So thank you. And